This is Dr. Samir Islam. I want to thank you for joining me today on this Facebook Live video on ReShape. And today I want to see if I can answer some of the questions you may have about the ReShape program, what it entails, who are the best candidates. And so we were able to poll a lot of people who are interested in ReShape to answer some of these questions. And I hope today that I can give some of those answers that you may be wondering about whether this program is the right program for you, whether you should do ReShape or not, and what are some of the risks and benefits. So I appreciate you guys listening to me. My name is Dr. Samir Islam. I am a GI doctor in a town in Lubbock, Texas, which is in West Texas. I've been practicing here for the past couple of years. I actually grew up in this area. I'm from Odessa, Texas, which is about 2 hours away from where Lubbock is. You may have heard of Odessa. It was the home of Friday Night Lights, and that's actually where I grew up. And so not a lot of people know a lot about Lubbock. It's a very beautiful place. It has beautiful sunsets. Obviously, because we're in West Texas, there's a lot of oil. And we have a lot of dust as well. And so we call this a typical Monday in Lubbock, where you have a lot of dust and a lot of sandstorms. But one thing that Texas is known for, especially West Texas, is football. And obviously Lubbock is the home of Texas Tech football as well. And so I'm a practicing gastroenterologist and hepatologist. So I specialize in a lot of digestive disorders. And one of the disorders I specialize in is weight loss as well. And my day typically deals with a whole bunch of poop. But today, I want to talk about what I can do to hopefully help out with your weight loss goals, and specifically what we can do for ReShape. And so the reason I got into the weight loss program, the reason I started to do ReShape is I noticed a lot of my patients had a lot of GI issues that was a result of obesity, whether it's heartburn, reflux, regurgitation, fatty liver disease, IBS, colon cancer, or even esophageal cancers. All these conditions within the GI world are all related to obesity, and we know for a fact that treating obesity, or at least minimizing the weight, will actually resolve a lot of these conditions, whether it's heartburn, reflux, fatty liver disease, diarrhea from IBS, colon cancer, and esophageal cancer as well. But when you look at obesity beyond GI, there are a lot of other medical problems that are associated with obesity, whether it's high blood pressure, diabetes, arthritis, having achy joints, achy knees, having heart failure, having heart problems, including heart failure or heart attacks, and at least 13 other cancers are directly associated with obesity. And so there's a lot of medical problems that have obesity either at its core, or is a big problem that's clinically relevant that is associated with that. And we know that treating obesity will resolve a lot of those medical problems that people have. But there are other problems that people have with respect to obesity that are not medical related, and I think this goes to the heart of why people want to lose weight. We know that losing weight and not being obese is good for your health, but the things that are really important, which I've understood through my patients, is the simple things like not being able to play with your kid, or being very, very tired because of the obesity epidemic that you may have, or having to shop for bigger and bigger clothes, or being embarrassed, or having even stereotypes because of the way you look because of obesity. And these are the things that, for a lot of my patients, that really drives them to help them lose the weight. And if you are living with obesity, I know you can understand what that's like. Whenever you're not able to run around with your kids, if you have young kids, or whether you have to find special clothes that can fit you, it's a discomfort that I don't want people to have to suffer through. And I notice a lot of my patients who are obese were having these issues. And so I wanted to have some way to hopefully address the obesity epidemic. We know it is a large epidemic because almost a third of the U.S. population is classified as obese. It's a chronic national health problem, and we've not made good strides to alleviate that. Now, a lot of people have tried other things to help out with weight loss, whether it's medical and lifestyle therapies, and for some people, it can be effective. But even in the best results, and even in the best studies, there's only about a 10% reduction of weight. You're only losing about 10% of the weight that you have. So if you weigh, I don't know, let's say 200 pounds, you're only losing 10% of that. It's not a lot of weight that you're losing. And the worst part about that is that you only maintain that result in only 5% of the patients. So 95% of the people who go through some of the lifestyle and medical options for weight loss don't maintain their weight loss. They have this yo-yo effect where their weight kind of goes up and down, and they're not able to control it significantly. And because of that, people get very frustrated and they're wondering why they can't lose weight. And the reason why medical and lifestyle things don't work is, number one, it relies on willpower alone. It is really hard to maintain a strict diet for a long period of time, and it's really hard to maintain exercise for a long period of time. It's a hard thing to do, especially when life comes at you in all sorts of manners. The other thing too is that, if you're restricting your diet so much, if you're eliminating carbs completely, or if you're having only a certain type of food, it's just not fun. You can't go out to eat. You can't enjoy the things you want to do with your friends. You can't just have a normal life. It's very hard to live a life that has severe restrictions on what you can eat. And probably most importantly, it doesn't address the root cause, which are the behaviors that contribute to weight gain. For a lot of people, they just end up eating food, and they don't know why. They don't necessarily eat because they're full, but they eat because food is around, or they're depressed, or that's just the habit that they got into. And so, by doing some of these lifestyle or dietary changes, you're not really addressing the actual behaviors that contribute to weight gain. And so, if you can see within the U.S. population, more and more people are becoming obese, and because of that, we're not able to control the medical epidemics that are occurring because of that. And so that's led to a surgical option for people who want weight loss. And this is effective, and there's no denying it. Surgery is an effective option for weight loss. But surgery's been around for a long time, and even with surgery being at the forefront for weight loss, it's not been effective in containing the obesity problem. There are still people who get the surgery who still gain weight, and there are still plenty of people who don't want the surgical option for weight loss. There are inherent risks and benefits in undergoing any procedure, and even with the surgical procedure, there are risks and benefits associated with that as well. So because of this problem of obesity, and because of the long-term problems with that, and the fact that there are some people who don't want surgery, yet they're kind of stuck in terms of what they can do because they've tried diet and lifestyle, this is the advantage of where ReShape came in. This is kind of the people who are trying to help out with the obesity epidemic. So ReShape is a very effective dual balloon technology in which you have 1 year of comprehensive coaching, which allows you to lose the weight that you want to lose without the need for surgery, without the need of having to go through such severe restrictions, so you can live the life that you want to live, but also lose the weight that you want to lose to hopefully have you live a healthy lifestyle. And so ReShape is best used for those patients, for number one, who don't want surgery, number two, who could not achieve the weight loss goals that they wanted with diet and exercise, and also number three, who don't want a permanent change with their body. They don't want to change the anatomy. They don't want their body to be affected in any way. They want to have the same anatomy, but they want to able to lose the weight that they want to lose. And so this is the benefit of having ReShape. So ReShape is the first FDA-approved balloon that was approved for weight loss. So in a nutshell, it's 2 fluid-filled balloons that are placed within the stomach. It's an outpatient procedure. Takes about 10 or 15 minutes, which is completely non-surgical. You go home the same day. And this is basically the balloons that we have. We have 2 silicone-based balloons that we place in the stomach that takes up room within the stomach. So not only can you not eat as much as you used to, but you get full with the amounts that you do eat. And so with that, you're able to lose the weight that you want to lose. It's non-surgical. We don't cut you open. We don't have to do any change for your anatomy. It's done as an outpatient procedure in which we put you under sedation, and we use a very small camera to take a look down, place the balloons, inflate them, and then we're done. It's a very simple and quick procedure, and it's an effective way to help you lose the weight that you want to lose. So whenever we do the insertion, we're able to put you to sleep, so you don't feel any pain or discomfort. And the insertion is done through an upper endoscopy or an EGD, in which we put a camera down the food pipe in the esophagus. Once again, it's outpatient, takes about 10 or 15 or 20 minutes, and you go home the same day. You don't have to wait in the hospital. You don't have to be admitted to the hospital. You can go home and sleep in your bed that same day and to achieve the weight loss goals that you want to achieve. So the question is, how does ReShape work, and Why is this just a novel way to help you lose the weight? Like I mentioned before, number one, it makes you feel fuller quickly. And so the foods that you eat, you just cannot physically eat as much as you want to. You get full a lot quicker and a lot sooner than what you normally did as well. But the most important thing for me for the Reshape program and the patients that have done the best is the accountability, and that is critical to maintain the weight loss. So with the Reshape program, you follow up with a nutritionist once a month for a full year, and you have a full online support with the Reshape community. These two items are critical to help you lose the weight that you want to lose. It provides accountability to have somebody watch over you, to let you know, hey, this is what you should eat. You have personalized coaching. These are the carbs, proteins, and fats that are tailored to your particular body to have you have the goals that you want to lose. And what we found is it's that accountability that's been critical to help you lose the weight that you want to lose. And I tell all my patients this: I can put a balloon in your stomach and you will lose some weight. But if you don't follow up with the accountability, if you don't follow up with the personalized coaching that we offer for you, you're not going to achieve the weight loss goals that you want to achieve. And it's that accountability that is critical to not only help you lose the weight, but to maintain the weight loss as well. And it's been a very effective option that we've had for our patients who have wanted to lose the weight that they wanted to lose. So the personalized program is critical for the Reshape process. Once again, it's a full year program of personalized coaching. You see a nutritionist once a month for a full year. You have monthly check-ins. This provides lifestyle changes. You get to review the progress that you've made, and you help to discuss your goals and strategies for what you can do to hopefully maintain even more weight loss. So your goals may change. As you go through the whole Reshape process, you may think that, hey, I want to lose this much amount of weight, and those goals can be tailored, and with those changing of the goals, we can alter what type of foods that you want to eat. And so this personalized coaching is it's a coach that you have to allow you to achieve the weight loss goals that you want to lose. But not only that, though, what I found very critical for the Reshape program is the full online support that you get with the patient portal. And this provides a huge collection of information that you can use at your disposal to help you lose the weight that you want to lose. You get information on nutrition, exercise, behavior modification. You get community resources. You get to log in your weight, see your activities, do calorie tracking, and not only can you see your progress that you've made, us as clinicians and your nutritionist can see the progress you made as well. We can see, hey, if you're plateauing us at a certain point in time, we can maybe alter some of the ways that we're approaching our diet to help you lose the weight that you want to lose and to help you have the goal of the weight loss that you want to lose. And the combination of the coaching with the online support has been instrumental in allowing our patients to help them lose the weight that they want to lose. So one of the biggest questions I have is, what type of results will you expect with the program? And so if you look at the studies, the average weight loss is about 30 pounds. But I will say in my personal practice, I think this holds true for most people who do Reshape. Our average weight loss in our practice is about 50 to 60 pounds. We've had patients lose up to even 80 to 100 pounds. And so the weight loss goal is very doable. And a lot of it would depend on the patient's commitment to the program. And I tell all my patients, if you don't commit, if you don't follow up with a nutritionist once a month for a full year, you're not going to have the goals that you want. So the average weight loss probably across the country in the study is around 30 pounds, but I would say that's an underestimation of the real life experience that I've personally had. We've had patients lose up to 80 to even 100 pounds with the Reshape program. And so how do you maximize your weight loss? And the most important thing you can do if you do decide to do the Reshape program is to be committed to the program. It's a full year program, and it's very important for you to be committed, because if you're not going to achieve the goals that you want to do. And so having that nutritionist follow-up once a month for a full year is almost imperative to help you lose the weight that you want to lose. Without that, it is very difficult to do that. So a lot of questions that we get is, why is the balloon placed for only 6 months, and can you get the balloons placed again? The reason we have that, it's done as a safety precaution. The FDA wanted the balloons in there for 6 months, and that's why we do it. It's purely for safety. Now, can you get the balloons again? You certainly can. There is a trial period after the 6 months where you have to wait, and once you do wait after those few weeks, then those balloons can be placed one more time, and the clock resets, and then you wait a further 6 months. And so I've had patients who've had the balloons placed multiple times because they've had good success with the initial balloon placement. And so if you need to get the balloons placed more than once, you certainly can do that. But I would refer to your healthcare provider to discuss what the details may be for that particular program. Now, a lot of people ask me, why would I want to do reshape when I can do surgery? And I think that's a very excellent question. So we know for a fact that surgery is effective. We know. It's very clear in the right patient that surgery is an effective option. But there are a couple of issues that may come up with surgery. Number one is that there are inherent risks with any type of procedure, whether it's reshape, whether it's a colonoscopy, and whether it's surgery. Any procedure that you do, there are risks. And with surgery, keep in mind there are risks with that procedure, whether there's leaks from the surgical site, whether it's an infection, whether it's problems with the incision, and even the fact that it may not even work. There are plenty of patients who've had gastric bypass who still regain the weight. And so there are inherent risks with any type of procedure. The other thing about surgery is that it's permanent. So once you've had the surgery, your stomach has changed, your anatomy has changed. And so it's not the way it was before. And so that is a permanent change that can occur. And for a lot of people, that's scary. You may not want this permanent change within your anatomy, and it can be worrisome for a number of people. And lastly, too, there are vitamin deficiencies that can occur with surgery. You have to take certain vitamins to make sure you're not deficient in them when you have the surgery because of the changes that occur with the anatomy. And so, for the right patient, surgery is great, and I do recommend surgery in the right patient. But there are a lot of people who don't want that, and there are a lot of people in which surgery may not be the best option for them. So the benefit about reshape, number one, it's effective. It actually works, and it's worked in my practice, and it's worked in a lot of physicians' practices as well across the United States. Number two, it's not permanent, and that's the important thing. We are not changing your anatomy. We are just placing the balloons in there, and we leave them in there for 6 months. Like any procedure, including reshape, there are risks and benefits, and so there are risks, including with reshape. We'll talk about those in a little bit. But also an important thing to realize is that there are no vitamin deficiencies with respect to reshape, and so you don't have to worry about being deficient in B12, magnesium, calcium, other vitamins which you may be deficient in other types of surgeries, and so you don't have to actually worry about that. So there are some people in which I don't recommend reshape for, and this is my own personal opinion. But if you're the type of person who's not done any type of weight loss options in the past, so if you've not tried exercise, you've not tried any type of nutritional visits, if you're not committed to the program, this is not the right option for you. And I'm very clear when I speak to my patients about wanting to reshape. If you are not committed to the program, you are going to waste your money and you're going to waste your time. This is not the right thing for you. The patients who do the best are those who've been committed in the past, who've tried other things, or they're committed to the program in the future. If you don't feel like that's for you, I would not recommend the reshape or any type of balloon therapies for you. There are some clinical criteria in which we have to keep in mind. If you have a BMI greater than 40, I would discuss with your healthcare provider about whether reshape would be the best option for you. If you've had previous stomach surgery before, so you've had a gastric bypass, or you've had some type of surgery within the stomach, reshape would not be the best thing for you. If you've had a large hiatal hernia as well, reshape would not help you out. Reshape would not be the best thing for you as well. Or if you're on some type of blood thinner and you can't be off during the 6 months while the balloon is in there, reshape would not be the right thing for you. But that's basically it. And so if you're not one of these patients who has not had previous stomach surgery, who doesn't have a large hiatal hernia, or not on blood thinners, I would consider doing reshape, especially if you tried other things to help you lose the weight. You're not actually at the goals where you want to be. Now, the best patients for reshapes are those who are committed to the program. So you're committed to exercise, you're committed to the nutritional program, and actually those patients who are best are those who've tried other things in the past. So you've tried Jenny Craig, you tried WeightWatchers, you tried maybe Paleo or Atkins, and you've not gotten the results that you've wanted to before. That shows that you're committed to some sort of lifestyle program. And these are the patients who do the best. The ones that have lost, in my practice, the 80 to 100 pounds are those that have tried other things and or committed to the program that we offer them. And those are the ones who've done fantastic with the reshape program. And obviously, if you don't want surgery and you want to lose weight, reshape would be the best option for you. And I think that would be a way to hopefully achieve the goals that you want to do. So some of the side effects about the balloon. Number one, will you feel the balloons? And I will say that there are some patients that do feel the balloons. So there are some patients that don't. It kind of depends on how your body is. I've had some patients who, as soon as we place the balloon there, they don't feel anything. They don't feel anything. They're not even quite sure if we've done the procedure, but I have the pictures to show them. I have some people that may feel some balloons on an occasional basis. I've had some patients tell me whenever they do crunches, they can maybe feel the balloons that are there. But by and large, I would say, in my experience, the vast majority of patients do not feel the balloons on a routine basis. So what are the side effects? And there are a couple of things I want you to be aware of when you have the balloons placed. And there are three main side effects that I tell all my patients. Number one, there is a risk of developing an ulcer in the stomach. It's a very low risk. So because of that, we have to have you on some sort of acid-reducing medications for the 6 months while the balloons are in there. That risk virtually goes down to almost nothing once you have that acid-reducing medication on there. Number two, there's a very small risk of the balloons being deflated prematurely. And if the way you would know that is that we actually fill the balloons up with blue dye. And so if you end up peeing blue, that's a sign to us that the balloons may be deflating. And we'd have to check to confirm if the balloons have been deflated or not. And if they have, that would be an indication to remove the balloons. The biggest side effect I tell all my patients is nausea and vomiting. That's not a permanent side effect. And it doesn't happen universally for everybody, but it usually happens for about a week to 10 days, and that's been the typical way it's been within my practice. And so I will give my patients anti-nausea medication to help out with that, and I know a lot of patients, or a lot of physicians who do ReShape will do the same thing, but nausea and vomiting tends to be the biggest side effect. I tell all my patients, number one, it's not permanent, it will not be forever. And number two, it will be temporary. And number three, we will give you medications to help preempt that. And so we will be with you to hopefully help out with the nausea and vomiting. Some people may need some fluids to hopefully get them replenished, but there are options that we can do to help out to prevent that. But beyond that, most of our patients do really, really well with respect to the side effects of the nausea and vomiting as well. A big question that we get is, can you work out or travel? And yes, of course. The whole point of the program is to allow you to live a normal life. And so we would want you to work out. We would want you to travel. And I encourage my patients to do that. The first week or two, you may feel that the sensation of something being in your stomach whenever you work out, for example, if you do crunches or you do sit-ups or things like that. But that has never precluded any of my patients from working out or traveling as well. And so most of our patients actually return to work very quickly after the balloon is removed. And so from my standpoint, you can do it. Now, each individual patient may vary with respect to the response to the balloon. So some people may need to take some more time off or may not work out as actively as they did before initially. But I would say within my practice, by and large, most patients and most people are able to go back to their normal activities very, very quickly. So how will you know what to eat and can you drink with the balloons? So number one, this is the role of the nutritionist. And this is why it's very important for you to follow up with a nutritionist and also have the ReShape patient portal, which has recipes that can help you lose the weight that you want to lose and actually help you adapt to have you eat the correct type of food that you want to eat. And the accountability is very critical with respect to that, because it's that accountability that provides you with the weight loss that you want to do to hopefully allow you to achieve the goals that you want to do. And then, with the online coaching that you have and with the online support and with the coaching that you have, this can allow you to tailor your diet to your specific goals and your specific needs. And yes, you can drink with the balloons. There's no problem in terms of drinking alcohol with respect to the balloons. And what type of support will you receive with the ReShape program? This is why I think ReShape is a very effective option for our patients. So it's that 12-month accountability, a full year program that we offer our patients to help them lose the weight they want to lose. And it's that accountability. I keep on stressing that, but it's that accountability that I think is the secret sauce for ReShape. This is why we've been very successful with our program. This is why we're able to lose the weight that you want to lose. You get personalized coaching that's tailored to you. What is good for your lifestyle, what is good for your goals. And plus you have the full online support with the ReShape online portal system to give you tips, to give you recipes, to give you encouragement, and to track your progress for how you're doing with your weight loss goals. And so I would say that it's by far and large the reason why we've been successful is the coaching we've had, and that is critical for anybody who does the Reshape program. And most of our patients who are able to achieve the significant amount of weight loss are those that have been able to follow up with the coaching and follow up with the nutritional visits. Now, I know you're going to be wondering about some of the other balloons that are out there, and I would encourage you, I would encourage you to go see the other balloons to see if you think that they may be better options for you. And so there are three main balloons that are out there. One is a Reshape balloon, which is the two balloons that are in there. They're fluid filled up with blue dye. Then there's the Obera balloon, which is a single balloon, which is filled with fluid as well. Then there's the Obalon balloon, which are three balloons which are filled with air. One of the benefits I found about Reshape myself is number one, it's effective. That's the most important thing. It's been very effective to help out with weight loss. Number two, it's safe. And so you may have heard about the FDA warning about some of the concerns with the new balloon therapies. And so when we reviewed the data, number one, we're not quite sure why patients had died from the balloons. When you look at the data, there were a few patients that had severe complications that led to death with respect to the balloons. Most of those patients were not with the Reshape balloon. In fact, there's only one patient with the Reshape balloon, and we weren't quite sure what the cause of death could have been on those patients. But by and large, though, with respect to all the balloons, in my opinion, the Reshape balloon is a very effective and safe option for patients. The other thing I found beneficial about the Reshape balloon is that it's two balloons. And so in my mind, that seems to make more sense. When you have two fluid-filled balloons within your stomach, it would take up more space within the stomach, which would make you feel fuller quicker than what you normally would. But I would encourage you to visit the other balloon websites and see what you think. I'm very confident in the Reshape program that we have for our patients. And so the other question is, how much does Reshape cost? And a lot of this depends on where you're located at and the location of the person who's providing the Reshape. The costs can range from as low as maybe $5,000 to as high as maybe $10,000 as well. A lot of which depend on where it's located at, where it's done at, and a lot of other different factors as well. But let me kind of tell you what the Reshape program typically includes. So it includes, number one, the cost of the balloon. It includes the cost for the sedation to put the balloon in. It includes the cost with the scope to place the balloon. It includes the cost to remove the balloon, the cost for the sedation for that, the cost for the endoscopy to remove the balloon. It also includes a Fitbit, a wireless scale. It includes a full year coaching program with the nutritionist. You also get a full online support. So don't think about this as just a one-time cost and you're done. Think of it, number one, as a lifestyle change, but also a year cost as well. And so I think that's a change in the mindset in terms of how you think about cost with respect to Reshape. I'll talk about the cost of obesity in a little bit, but that's how I try to tell my patients, is that it's a lifestyle change that you're paying for. And so does insurance cover Reshape? Currently, no. There are some insurances, supplements, including AT&T, that does cover the Reshape program. And I do anticipate, and this is just my own opinion only, that in the future, more and more of these balloon therapies will be covered because of the success that we've had. But currently, as of right now, there are very few insurances that cover the Reshape program. And is financing available? There certainly is. It depends on where it's done at. We have financing available locally, and we have national financing available at our institution as well. Wherever the provider who does Reshape, they may have financing available either at their institution or nationally as well. And so there is financing available for those patients to qualify. And is it worth it? Now, this is the biggest question I have, because I completely understand. It's a very expensive procedure. It's not something that a lot of people can just put the cash down. And so here's how I think about it, is that when you think about obesity and the long-term consequences with that, so obesity is not just being big. It involves a lot of long-term medical problems, whether it's needing a hip replacement, needing a knee replacement, developing end-stage kidney disease and being on dialysis, developing heart failure, developing a stroke, developing cancer, the medications for your diabetes, the medications for your heart failure, the hospitalization you may have from having a stroke, the physical therapy you'll need from having that knee replacement. Those are just the medical problems. But the other problems, like I mentioned before, the inability to play with your kids, the inability to wear clothes that you're happy with, the inability to shop at the inability to shop at a store that may or may not have your size, having to maybe buy 2 airplane seats, just the emotional cost of obesity. These are things that to keep in mind about whether it's worth it, because when you lose that weight, those medical problems will go away, and that emotional problem that you may have carried with you will go away as well. I've had patients who've come to my office who have been wheelchair bound, who've had to have oxygen, who had severe arthritic problems, who we placed the balloon, they're able to walk now, no more oxygen, their pains went away, their reflux went away. It's a whole new person who's come to see us after we placed the balloon, and it's hard to describe the dramatic change that not only occurs physically but emotionally for our patients who are able to lose the weight that they did with the ReShape program. And so I completely understand the monetary costs, and I wish this was covered by insurance. But if you look at the long-term problems with obesity, both emotionally and medically, it seems to me, in my opinion, to be worth it. And so what are the next steps? So if you are interested in ReShape, number one, you can come make an appointment with me. We take out-of-town visits. We're welcome. I've done patients as far as Tennessee. We do out-of-town visits. I do this procedure every single day. We do our nutritional follow-ups via email or via the phone. I would encourage you to contact us. The consultation with me is free. And so even if you're interested in the program, if you want to make an appointment with me, that appointment with me is free. And I would encourage you to come, because I think we can get you the goals that you want to do. We've done a lot of we've done a lot of balloon therapies on patients with ReShape, and we've been very successful with our program. And so if you are interested, I would encourage you to visit my website. I'll put a link at the end of this Facebook Live to how to make an appointment, or you can call our office at 806-761-0747. If you're out of town, that is not a problem whatsoever. We can work around your schedule to help you lose the weight that you want to lose. But I want to thank you guys for joining me today on this program for Facebook Live about ReShape. It's a very effective non-surgical option for weight loss. If you have any questions, I would encourage you to post them on the Facebook Live. I will be able to answer them. Or you can certainly send me a message through the contact, which I'll add on to a link here as well. But I want to thank you guys for coming in and listening to me. If you are interested, every Wednesday night at 8:30 p.m. Central Standard Time, I do host a Facebook Live on a lot of other GI topics, whether it's IBS, Crohn's, ulcerative colitis, reflux, GERD, liver disease, hepatitis. And so every Wednesday, feel free to watch my Facebook Live. But I want to thank you guys for joining me. And if you have any questions, feel free to contact me. And I would love to see you either see me in my office for ReShape, or see any other provider who's closest to you to help you achieve the goals that you want to achieve. But thanks and take care. Have a good night.